Welcome to There She Is, the podcast by Women's Sport and Recreation Tasmania. This is a space for celebrating women in sport, the athletes, coaches, administrators, volunteers, and leaders who shape our sporting communities. We talk pathways, visibility, lived experience, and what works for women in sport right here in Tasmania and beyond. Because representation matters and every story deserves to be seen. Hi everybody, it's Philippa here from Women's Sport and Recreation Tasmania. And today I'm really excited to introduce you to Peta Titter, who is the founder of WEN, the Women's Health and Education Network. She is a very talented woman who has so much knowledge in the women's health space. If you check out their website, so when.org.au, you'll find incredible resources for teenage girls all the way through to postmenopause and everything in between. So thank you so much for joining us today.
Oh, thanks so much for having me.
It's so good to have you here. Now, I also wanted to mention too, not only is she experienced here, she's a Pilates instructor, an incontinence nurse, and she's currently doing a PhD in the non-reproductive changes in pregnancy and postnatal with women too. So we're going to share a whole bunch of other resources and knowledge around all of that. And, you know, given the topic that we're going to be speaking about today, which is perimenopause, because this affects athletes, but we also want the clubs and coaches to be able to support women going through this phase because they're such an important demographic. We want them to participate well into all of their years, and there's so many things we can do to support them, make them feel valued, make them feel like they're seen as a whole athlete and not just another number sticking up, but someone who is a really incredible resource to your club or your sport that you're involved in. So let's dive in. Can you tell us what exactly is perimenopause?
So perimenopause is really misunderstood because people think that it's a very distinct period. Basically, it's really menopause and perimenopause is still defined by your periods or your ovaries. So it's any change in those sorts of areas. So even if your period has changed by, say, you used to do a 4-day cycle when you bled, and now you're doing a 3-day cycle or a 5-day cycle, that is a change in your period. But because it's so subtle, so many women miss that. So perimenopause is the build-up to menopause, and it's very distinct because you can only call yourself menopausal after you've had 12 months without a period. And then after you've done that, you're postmenopausal. So really, if you think about it, you're only menopausal for 1 day. And then you're postmenopausal. But because medically we define it by our ovaries and periods, it really doesn't explain what it is, and it hasn't historically, because it is very hormone driven, but estrogen affects our muscles, our tendons, our brain, our mucous membranes, everything in us. So it's not just about your ovaries. And I think when we're talking about exercise of any form, whether it's recreational or at a high elite level, we've got to discuss the fact that it's going to impact your brain, your muscles, your tendons, your skin integrity, everything. So we have to look at women as a whole instead of looking at one defining aspect of it.
Awesome. I love that you highlight that because I know from my own experience in talking to friends, they often don't realize till they're looking back and they have these unusual symptoms they're not used to, and they do miss it because there's such subtle, tiny changes. Is that common for most women?
It's common for women through their life cycle because we're also told that these are normal parts of aging and it's a normal part of being a woman. So we just accept these changes without thinking, oh, well, maybe I shouldn't have joint pain or maybe I shouldn't be feeling this. We just taught that it's a normal part of what women go through, and so we accept it. So I think it's time as women we say normal doesn't mean that it's okay and we have to sit with it. It just means that it's frequently occurring and we can deal with those sorts of things.
Amazing. And we'll talk today about some of the things that we can do to better support women rather than just trudge on and carry on through it as well. So what, besides the period change, what other physical or cognitive changes might signal to us that we're in that phase as well?
Well, there's lots of controversy about this. So there's the conservative side of perimenopause and then there's the progressive side of perimenopause, and they don't agree on the symptoms. So you have to look at it as your own body, and as a baseline, you can download some of the checklists to see whether you're getting it. So it's change in periods, change in moods, but some of the new statistics that are coming out is that more women get joint pain than hot flushes. So we always think of menopause as hot flushes and dealing with hot flushes, but it's in the high, between 60 and 80% of women get joint pain. And hot flushes aren't around that. And joint pain is definitely going to impact a woman's ability to exercise as much as hot flushes do. Hot flushes are terrible, but we need to look at it as, your skin's going to change right down to your teeth, your vagina, everything changes about you, even your deodorant. And I know that's something really weird, but you have to change with your body. So if the deodorant you've always used stops working, you need to go to a different deodorant. The idea is that we persist with our skincare and our deodorant because it's what we've always used. But as our body changes and our hormones fluctuate, you can have different body odors, and that can be really embarrassing when you're exercising, especially if your deodorant stops working all of a sudden.
Wow, this is really fascinating because it is so common that hot flushes, they're the superstar of the symptoms that everybody knows about. But
Mm.
can joint pain get confusing whether they're participating in an activity, and how might they differentiate between they've actually injured themselves some way, or like there must be a balance there?
Well, it's really hard because in perimenopause and menopause, women are more prone to frozen shoulder and plantar fasciitis. So if you look at those, they are injuries and they have to be treated. But what I would say to every athlete or anyone who's exercising, if you're getting symptoms of a frozen shoulder or plantar fasciitis, is to treat it as early as possible, because the longer you leave it, the worse it gets. And it's the change in your fascia as well. So it's like a frozen capsule. And so women know their own bodies, and there's a difference between an injury, which I would class frozen shoulder and plantar fasciitis as an injury, over the general aches and pains in your joints. We say, oh yeah, we're getting older, it's expected, but it's something that we shouldn't deal with. And it's like we've seen many women go to doctors with knee pain, and the response that they're getting is, well, what are you expecting? You're getting older. Well, what we're expecting is for you to treat our knee pain so that we can stay active and keep our muscle health happening and our bone.
Oh gosh, I love that. We all need a little Peter in our back pocket when we're going to these appointments. So are you saying particularly like with frozen shoulder and plantar fasciitis, are the symptoms sort of worse because you're in perimenopause, or it's just more likely to happen?
It's more likely to happen. There's not much research in it, as I'm sure you know, that women are really not researched well. And one of the reasons we're not researched well is because our hormones make it really difficult to get set data sets, and researchers don't like that. And so a lot of what we know about exercise and sport is from men. And we are very different to men. We have different bone strengths. We have different bone structure. If you look at our pelvis compared to a male's pelvis, very different. Our pelvis is designed, whether you have a baby or not, to alter and change, and specifically with hormones. So if you think about the fact that your estrogen and progesterone levels are dropping, your strength around your pelvis is going to change.
And are there any massive sort of myths or misconceptions that really bug you that you would love to share or debunk with us today?
Yeah. So one of the big things that we're seeing in the fitness industry or about exercise is bone density is the most important thing. It is so important. We do not want to get frail. So if you look at women, we live to 83. It's 84 or 85 on the mainland, but in Tassie, we're 2 years younger. I don't know why. But
Interesting.
we start to become unwell in our early 60s. So it's not worth living to 83 if you're confined to a nursing home, breaking bones and incontinent. So what we want to do is keep women really, really active during this period. But what people are really focusing on is bone strength. And they're saying you have to lift heavy, you have to lift the heaviest you've ever lifted. But they're not looking at the woman as a whole. So it's not just about bone strength. We've also got to look at the fact that once you get to perimenopause and menopause, you are more prone to incontinence and prolapse. And so if you're lifting the heaviest you've ever lifted in the way that they're recommending, the chances of you leaking urine or farting or even fanny farting are really high, which is embarrassing. And also if you're in the middle of a group training session, and also the chances of you prolapsing increase. So we need to look at the woman not just as let's get her bone density up, let's get her muscle density up, let's make sure we're protecting her it's not reproductive health, it's actually just your uterus, your vagina, all of those sorts of things, because incontinence is a really hard thing to live with. And a lot of women drop out of sport during this period because their continence level changes. That was a
Yeah.
very long-winded way of answering that. Sorry.
No, that's great. Like continence is a major issue, and a lot of people will tolerate it or just use a pad, but it's certainly things we can do to improve our pelvic floor strength, right?
Yeah, and it's not just about pelvic floor strength. I would highly recommend that everyone starts doing pelvic floor exercises But you need to go and work out what works for you. Because in a group class, so I'm just going to use me as an example, say I've got a weak pelvic floor and then you've got a tight pelvic floor, and your coach is saying, okay, everyone lift your pelvic floor, then release. For me, that will work. But for you, that could lead to pelvic pain and painful sex. So you need to understand your own pelvis and what's happening in your body, because everyone is different. The realm of the coach or the trainer is to talk about pelvic floor and say, make sure you know about your own pelvic floor, work out what's happening in your body, because your pelvic floor is actually the base of your core. And if you think of your core as a cylinder, if any part of a cylinder has a weakness, you're not going to be able to be as effective in what you're doing. So if your pelvic floor isn't working with you and for you, the chances are you're not getting the best out of your core. And so it's really important to be aware of that. The problem with pelvic floor is pelvic floor physios are fantastic and I recommend them all the time, but they're really expensive and not everyone can afford to go to a pelvic floor physio. But there's some great stuff online. So the Continence Foundation of Australia is fantastic. They've changed their name to Australia Continence, I think. But somewhere like that is a good place to start. Or going to a women's health GP that can be covered. But it's really important that you think about this sort of stuff we should be thinking about it from 16, but we don't get taught about it. And so it really becomes an issue in your 50s and 60s generally, or 40s and 50s. And even though my PhD is on postnatal and pregnancy changes, that is impacting women as they go through menopause. So it's something that there's so many little things you can do. So learn about your pelvic floor. Do a pelvic floor regime, what is right for you, whether you've got a tight pelvic floor or one that's not as effective. The other thing is our vaginas totally change when we don't have estrogen. This is the easiest way to describe it. It's not anatomically correct, but the shaft of our vagina, lots of people think, because this is how it is taught in school, that it is always open. So it's always a shaft and it's always just an opening that goes all the way up. Now, if you actually looked at a vagina without something in it, those two sides of your vagina touch always, unless you put something in it, like a tampon or whatever else you're going to put in it. But with estrogen, those two sides of your vagina are like ribbons. So it's like a shock absorption. So when you run or do sport, you've got this extra absorption. But once your estrogen is depleted, those ribbons go away and they become straight lines. And so when you start running or when you start doing exercise, you get micro tears in your vagina, which is really painful. And because there's no friction, like there is lots of friction, but no way of supporting them. And so things like moisturizing and lubrication is so important. So if you think about how much money we spend on our whole body with moisturizers, think about it. We wear lip balm, we face cream, arm cream, hand cream. We spent a fortune in our lifetime moisturizing every part of our body. We don't do anything for our vagina. Nothing really. It's just kind of left there. But if you think about your mouth as the same sort of tissue as your vagina, you wouldn't not clean your teeth. You wouldn't not look after your lips, things like that. Same thing with your vagina, especially when you're doing exercise. We brought an amazing menopausal doctor over. I think she is menopausal, but she is lecturing in menopause for the Continence Foundation last year. And she was saying one of the best things you can do is if your mouth is feeling dry, your vagina is probably dry too. And so when you're exercising, just use something like coconut oil, it's cheap. Obviously get the cleanest one you can, like an organic one if you can afford it. But just using something like that will make it so much more comfortable to exercise. It'll just make it so much easier. And she's like, when you're flying, use it because, you dry out. And just little tips like that can really help someone who's exercising to not be uncomfortable, because these vaginal changes can get significantly bad to the point where it's uncomfortable to sit, at work, it's really awkward. If you're running like on a hockey field, it's going to be really awkward. So if you can counteract these, it's a really great option.
Yeah, that's amazing. I've never heard of using coconut oil. I think a lot of people would assume just a lubricant, but coconut oil
And
you can use internally.
a lubricant is very different to a moisturizer as well. So you should be using both.
Gotcha.
So some things work as both, some things don't. So think about, everyone knows what KY gel is. That is only a lubricant. Won't give you any moisture back. There's lots of new research around vaginal estrogen cream that it reduces women's chances of UTI as you get older. Now, this is something that is really common in perimenopause, UTIs, recurrent UTIs, especially in the athlete, because you're sweating more and, you know, just running around and doing things. And
Yep.
so we know that vaginal estrogen can reduce your chances of UTI by 60 to 80%, which is massive. And it knocks out women having to use antibiotics and create a resistance. And they know that it's even safe if you've had breast cancer. So we don't know the long-term results because it hasn't been used for long enough. But what it's looking like is fantastic. It helps you do your pelvic floor work as well. Use it for, I think it's 2 weeks every night for the first 2 weeks, and then it's just twice a week.
Wow. Yeah, that's incredible. Now, you've talked about getting to know your body, and sometimes when we have a regular menstrual cycle, we might be monitoring changes. Is it important still to track some of those changes across perimenopause? Is that helpful, like when you've got that data to take to your health care provider?
I think it's helpful, but it's really hard. It's because it can become so irregular that you don't know when it's coming. And the other thing is, a lot of the time you go back to like a 13-year-old period, where you flood and you just aren't expecting it. And so period undies, the best invention ever. It's one of the best things that's come out about women's health because you can wear them now, the other thing that you need to know is when your estrogen levels deplete, you lose a lot of hair, including in your pubic area. So if you're using a pad, which lots of women use pads are bleached. So anything that is white has to have bleach in it. Think about urine. If you're leaking urine has bleach in it. So if you've got a white pad and you're leaking a bit of urine and it hits it, and then you don't have pubic hair. So pubic hair is there to protect your labia. I know lots of women don't have it anymore, but as you don't have estrogen, your labia changes. So your labia minor can actually atrophy, totally go away. So you can lose the internal lips of your vagina. The external ones get really fragile and can get really sore. So if you're then having a pad with a bit of acid on it and it's rubbing and you're running around a hockey field, I'm just using hockey as an example, you're going to create friction burns, which is going to be even more uncomfortable. So get period undies. They're fantastic.
Yeah. Okay, great. So it really sounds like you need to trust yourself. So if you feel there's a change, to trust your body and to share that, even though, again, someone might have tight pelvic floor or weak pelvic floor, the symptoms might be different. So trusting yourself and your knowledge of your own body.
Yeah, a lot of women, though, turn that part of them off. That's one thing I would say. They just go, yeah, I just can't even face this. So if you are experiencing anything that is different, go and see someone. The government has brought out a new rebate for menopause that you can go and have a long menopause consult. You have to go. We're lucky in Tassie. We've got some really good doctors who specialise in perimenopause and menopause.
Amazing.
And so go and get that sorted. Hormone replacement is not for everyone. But if it is, and it's what you want to do, make sure you advocate for yourself. Because if you're going to a doctor who is not as au fait with menopause or perimenopause at the moment, then they're not all keen to deal with hormones. But it's something that you need to educate yourself on and decide whether it's for you.
Yeah. Awesome. Can you tell us a little bit more about the hormones? Like, we know that you've talked a little bit about estrogen, and what else does that affect? Does that affect our energy or our sleep?
It affects everything, and so does progesterone. So it affects your brain function even. There is some new research, but it's a bit controversial, about the fact that women are getting more dementia than men. Well, we know that's a fact, and they think it's because of reduced estrogen. But it hasn't been proven, and the doctors are fighting over it. But it's something just to keep on the back burner and keep an eye on. But what we do know is women lose words in perimenopause. So you can be looking at a curtain. Oh, this was me. I looked at a curtain and I'd say, close that thing. I could not remember the name of it. Or you'll be sitting talking to someone who you've been friends with for 18 years and you go, I have no idea what your name is. And that is really common. It's called a loss of word. It's really well documented. And it presents differently in everyone. So when I started perimenopause, I got pure rage. And I knew I needed to get some help when I was walking from my car or to my car at night. And I was like, I want someone to attack me so I can kick them. And I was like, right, I know I need to go to the doctor. And as soon as I went to the doctor and got it sorted, that rage is still there, but it's well controlled. So where my other friend lost all of her confidence. So it presents so differently in every different woman. That's why I'm saying we can't just look at it as a big thing. So someone who I worked with, who'd worked in this job for like 26 years, highly educated, she just said, I can't do it anymore because I don't think I'm good enough. And she lost that. And so we've got to look at women, especially when they're doing sport, and see what is best for that woman. Because for me, running and getting rid of that rage would have been great. But for her, she needed the confidence to get back into exercising. And it's really hard when your estrogen and progesterone levels dip to be motivated. So there's lots of women who lose their confidence, get a form of depression, and then trying to get them back into exercise, where we know that exercise is the best thing for them, but that getting them to step over back into exercise is really hard. You know, most of the women in perimenopause now still have kids at home if they've got kids. Not all of them have kids. They're also trying to care for elderly parents. They're also probably working. So this is a huge mental load on top of when your estrogen and progesterone are deleted. You're not sleeping well because low progesterone levels don't let you sleep well. And your brain isn't working the way you want it to. You're forgetting things. And as women, we are really hard on ourselves. And one of the things, if you're ever going to read a book about menopause, read The Menopause Brain. It's one of the best books you can read. It explains the woman's brain from puberty right through to death. And it's so interesting. And what they talk about is during this period of our life, we cannot multitask. So you know how we pride ourselves on multitasking?
Mm-hmm.
So what I say to women when they're doing things or at work, I say, look at your male colleague next to you, see what is on his plate, and then copy what is on his plate. So if he's working on one project, which he probably will be, and he will work just on that project, you just work on that project. Do not put extra things on your plate. It will pass, and it does come back to multitasking. But for that period of time, work like a man would. And I know that sounds very sexist, but that's the best way to describe it.
Yeah. Oh, it's interesting. And so I'm thinking, like, from a coach perspective or a group leader who might be looking after women in this age group, there's so many different things to sort of look out for because everyone reacts quite differently. There's a huge amount of patience and empathy they would need to exert.
Yeah, and I think, look, we believe that men need to get involved in this conversation. They 100% need to be here. Because if you look at women's health in general, the only women's health that is well funded is the women's health that has been started by men. So breast cancer, started by the McGrath Foundation. Some of the ovarian cancers started by husbands. So they're really well funded. So men need to be involved in these conversations, but we need to teach them how to be involved in those conversations. So part of the problem is I've heard some men say, well, she's just menopausal. Now, if a woman doesn't define herself as menopausal, which most women don't, that is going to make her angrier. And so they need to just talk about that every part of a woman's life is different and hormones change every part of a woman's life. So, you know, in pregnancy, in puberty, in perimenopause. So they should be talking about it like it's natural and just say, because it is natural, say, you know, so I would train a 16-year-old differently to a 45-year-old because you have different hormone levels, you have different response levels, you have different life experience. So if you look at a 16-year-old on the hockey field and she's only been playing for like 10 years maximum, but if you look at a 46-year-old on the hockey field, she may have been playing for 30 years. So she has different techniques and different workarounds. And I think we cut those out and say, oh, well, they're not important. They are so important. And so I think coaches, especially male coaches, need to say that, you know, we need to work as a team. Everyone on this team has different hormones. You're not all synced. You don't all get your period at the same time. So we need to make sure we're cutting slack for everyone and making sure that it works in each person's favour.
Yeah, I love that. If you're getting an experienced athlete who's already figured out the workarounds to still participate in their sport, that's such a valuable resource that they can share with the rest of the team.
Yeah.
Um, Now, we've talked about a lot of people, women might drop out of sport or activity at this age. What are you seeing? What's the main reason for that?
Well, there's a few reasons. Your periods can become flooding, which is what I talked about earlier, and you just don't want to. It feels like you go back to when you're 13 and you're going to school and you're so embarrassed and you don't want to flood. You know, you don't want people to know what's happening because it's not just a little leak, it's a flood. You can experience an incontinence, which is, if you've never experienced it before, is really hard. Can have joint pain and aching. As we said, most women have so much on their plate and they always put themselves last. Oh, I don't need to exercise. I need to get the kids to soccer, or I need to get food on the table. I need to check on my parents. So we always put ourselves last, which is wrong, and we shouldn't, and we need to change that as a society. And just the getting off the couch and you're exhausted because your sleep changes, the type of exercise you do can change how you sleep as well. So HIIT, I'm not saying don't stop HIIT, but if you're going to do HIIT or high intensity anything, try and do it earlier in the day, because if you're doing it late in the afternoon or in the evening, especially in the evening, what's going to happen is it spikes your cortisol levels, but not in a good way. And so you're not going to be able to sleep. So then that sets you up for a bad day the next day, and then you're not going to sleep the next day. So sleep hygiene is probably one of the biggest things that you can look at. It's really hard for neurodiverse people because sleep has never been achievable in a lot of neurodiverse people. So then to have hormones change on top of that and cortisone levels change on top of that and try and sleep, it's going to cognitively affect you.
Oh.
But it cognitively affects anyone who doesn't get sleep. So think about not doing HIIT. That's one of the best things about perimenopause for me, that there's no pressure at all to do HIIT because it spikes your cortisone levels. And I'm like, yes, I've got a reason not to do it now. Love it. But if you love it yourself, if you love doing it, I'm not saying don't do it. What I'm saying is plan it correctly so it doesn't impact your sleep. So things like that, they need to do muscle and bone strengthening, because we lose between 8 and 10% of our muscle strength during this period as a woman. And then that's going to add to knee pain and foot pain. And so if you're getting joint pain, doing nothing is the worst thing you can do. But it's
I know that, but it's
logically what you want to do.
it makes it worse though, doesn't it? And the blood flow, yeah, absolutely helps.
Yeah. And so we lose 20% of bone density during this period unless we're
Yeah.
active. We
So
do
you
know
can slow that or stop that by being active?
it helps it.
Yeah,
One of the big things around this period is estrogen. So even a tiny bit of estrogen, like not a full dose of estrogen, works really well on bone density. But staying active is no matter what, you've got to stay active because you don't want to become debilitated.
absolutely. And so I guess for women who are potentially dropping out, like there can be a bit of a stigma. Maybe they don't want to talk about it, or they're embarrassed, or they don't know they're going through that. And you touched a little bit on this before about different vocabulary we can use that might be supportive, or things that might be less supportive. Do you have any advice there?
I think it depends on the team. I think if you're in a team sport, other females in your team sport are going to be your biggest supporters. But
Absolutely.
I think we get nervous about that and don't use other women. But if you think about yourself, if you saw another woman struggling, you'd want to help her. So you have to be able to take that help yourself. So it's really important that we treat ourselves like we would treat a friend, and we don't do that.
I love that. I've heard some advice recently too, like you're treating yourself like you're your own mother or you're your daughter. Like how would your
Yeah.
mother speak to you? How would you speak to your daughter in this situation?
Yeah, and it's the same with teammates, especially if you've been in a team for a really long time. And
Mm.
even though teams change, and there is no reason you can't get support from a 16-year-old as well. So you two are actually going through the same thing, just at different parts of your life. And it's really
Yeah,
good for them to see us as women talking about it and going through it, because they are going to go through it. Every woman goes through menopause, whether it's chemically induced, surgically induced, or like age induced. Every woman has to go through it. And so we don't talk about it because it's such a taboo subject, but we're not doing justice to those young girls and young women if we're not telling them what we're going through. And the one thing that I think is a really bad word, Karen.
oof.
So I have a real issue with anyone who calls anyone a Karen,
Yeah,
because it started off in the right way. It was someone who was being racist, they were being irrational. But what has happened now in society, that any woman who gets upset or angry or has an opinion is called a Karen,
mm,
and it silences women. And so we have to stop using that, because it's mainly used with menopausal women or around this age. And we have to stop using that, and we have to have some compassion. that they're really struggling. A lot of them are struggling. And sometimes when a woman loses her temper, she just doesn't know what else to do. And for so many years, we've been taught not to speak out and not to get upset and just go, yes, I'm the peacemaker. And you get to this stage in your life and you're just like, I don't really care. And that's okay not to care and to have opinions and to voice them. So we need to get rid of words like Karen or blaming menopause for their behaviour. It's not,
Yeah.
it's just something that is happening to someone.
I love that. And I love you touching on supporting each other, because I think there is a big shift where women don't always see each other as competition. Like, we can support each other, and that spirit of collaboration among women and nurturing each other is really strong. One of our great strengths for sure.
Yeah, like really good.
Okay, this is awesome. I'm trying to like compact it in my brain now. We've got so many incredible tips here. If we're just looking at the participant, if they're going for a walk or if they're participating in sport, what the core things they need to know, if we're just to summarize, to better support themselves through this phase.
Okay. So we're not 16 anymore. You need to do warm-ups. Even if you're going for a walk, think about doing a little stretch. It's not,
I feel personally attacked here.
you know, when you were 16, you used to be able to put on your kit and just go for a run. And then when you were 20, you'd probably just do a calf stretch first. And then in your 30s, you go, oh, do a glute stretch and a calf stretch. When you get
This
that
is
bit
so
older,
me.
just stretch your whole body. The other thing is, don't just stretch. If you are having knee pain or foot pain or hip pain, do some strengthening exercises before you do your exercise. So just some basic strengthening exercises, even if it's calf raises or some clams or some squats against the wall, just to turn your muscles on before you're going to put them under strain. So that's a really important thing. Make sure you're hydrated. We are not great at hydration in general. This new generation is fantastic because they carry around these massive water bottles. Our generation, not so much.
That's so true.
Magnesium can be a real help for women at night. It helps with sleep as well. The two things that are like supplements are really hard because supplements it's like an exploitation nightmare, really. And if you go on any social media, buy my supplement, it will fix your menopause, blah, blah, blah. The three that we credit as like from when is magnesium, vitamin D, especially for Tasmanians. And if you look at the government's recommendation, all Tasmanians should be on vitamin D. So vitamin D is bone health as well. Magnesium helps with muscles and sleep. And creatine. There's some really good new research about creatine.
Yeah.
And the good thing about creatine, and it's not just about building muscle, it's got some really good stuff around cognitive effect. The really good thing about creatine is it's cheap. It's the cheapest supplement I've ever seen. It's like $20 for a big jar of it, and you only need a tiny scoop. But it does take a month to kick in. It's not something you can just take willy-nilly, where magnesium you can be a bit more willy-nilly with it. So get those supplements sorted. You need to have high protein intake when you're perimenopausal, 20 to 30 grams, which is really hard to achieve. So don't beat yourself up. Don't get obsessed with eating. I went to a menopausal conference and the doctor was from America and she was talking about how obsessed she's become with getting protein in. She couldn't see it was bad for her, but she was saying she walked around with a chicken breast on her fork at work and just kept eating chicken. I tried to implement her recommendations the day I got back just to see how hard it was. You had to be eating the whole time. You had to be eating chicken breast. She was so obsessed that she brought in or tried to bring in meat to Australia because she didn't think we'd have enough. So you do need protein, but you also need fats as well and carbohydrates. It's not, you cannot do calorie deficit as a woman who's perimenopausal. It does not work. We know that now.
Yeah.
There's some really clear evidence that calorie deficit does not work for women who are perimenopausal, so don't do it. Make sure your vagina's sorted. I know I bang on about that all the time, but it's so important. It's going to make you so much more comfortable. Because if you're uncomfortable in an area that no one can see, like if your knee's uncomfortable, you can talk about it or you can rub it or you can strap it. Your vagina's a bit harder. So make sure you're lubricated and moisturised and everything's looked after. Do some pelvic floor work before you go on the field, whether it's learning to release or whether it's learning to lift and hold. You are different. Everyone is different. Learn yourself and don't be too hard on yourself.
I love it. These are amazing tips. I'm sure, like, if you just pick 2 or 3 of these and start implementing them at a time and then kind of get that under wraps, then you can gradually increase more instead of trying to do it all at once. So if we look sort of through the coach lens, the coach, trainer, whoever is the leader of that group, What are the key things that they need to know?
They need to educate themselves. They should not be relying on these women to educate them. If you've
Oof.
got women who are over 35 in any team or sport that you're participating in and you're in charge of them, get yourself educated and get yourself educated correctly. Do not do it from TikTok. Do not do it from those sorts of things,
Yeah.
because you shouldn't be expecting someone who's going through something to teach you how to go through it. When someone's grieving, you don't ask them how to support you. So why are you asking these women, what do you need from me? You need to go out there, find a really woman-friendly menopause education and learn about it, and then go back in and use language that is appropriate. Don't blame menopause. Don't use Karens. Don't, say, oh, they're just hormonal. Worst thing ever,
Yeah.
like, I was looking at something the other day, drop in hormones that happen within the 2 to 5 years that happen in perimenopause. The way male hormones drop, it would take them 125 years to get to our significant drop. So they
Yes, I
don't
heard that.
experience anything like this huge drop in hormones like we do. And it's huge. We experience it 3 or 4 times in our life, where they don't experience it. It's just a gradual
Mm.
thing. So it's really hard for them to understand. But they have a mother, a sister, an auntie, a wife, a daughter. They have someone they know. 51% of Australian population is women. They need to know this, not just about sport. They need to educate themselves, and we need to encourage them to educate themselves. And in women's health, sometimes we're not great at this. We're like, this is about women, you shouldn't have an opinion. They should have an opinion, and they should be educated, but they should be careful the way they voice their opinion. As
Yeah.
in, it's like with anything. If you want to be an ally to someone, you ask them how they want it voiced, not how you want it voiced, because you're not living it. And that's the same with menopause. But they need to learn the basics first. They can't just expect people to tell them what to do.
Absolutely. Being proactive is going to be so essential. So then if we're going top level and we're looking at the organizations, the clubs, the boards, the people running the clubs, I guess there's some cultural things they can do to support them. What else do you think would be helpful at that level?
Well, I think that they should implement perimenopause education. If you're going to have a club that has women over the age of 35, everyone should be educated in menopause. It's like now most coaches understand periods. Well, we hope they understand periods. It should be the same, young girls with periods,
Yeah.
like in schools and stuff now. If a girl asks to go to the toilet, you say, of course. You don't say, no, you can wait till the next period, as in because she may be leaking. But
Yeah.
so we've started to implement that. It's not great yet, but at least it's being implemented. The same thing should be implemented from a organisational level, that it's discussed, that women are supported, that, that sort of thing. I suppose that's the
Right.
best thing, that, like higher, and it comes from higher up. So your board needs to do this education as well, or the
And there's so
captain of
many
the
great
club.
resources, sorry, that you
Yeah.
can tap into that can provide that, whether it's, the women's health physiotherapists, so many other groups that'll either do it free or at a really low cost. And it really shows that your athletes that you value them and you're looking after them.
Even there's something as small as, goodness, see, menopause brain. I've forgotten the name of it. There's a group, 2 men, and they interviewed Dr. Louise Newson from the UK, and they talk about a men's view of menopause. So even just starting there, having men listen to that is a start. There's some really good podcasts. So that is a start to get them. If they can't organise formal training, there are some podcasts where they're talking to a female doctor about what is happening, and from a man's perspective, and so they understand it better.
Incredible. I have learned so much from all of this. I thought I was over a lot of these items, so I'm sure everyone listening have picked up some real good nuggets here as well. Is there anything else we're missing that we need to include?
Recovery. You've got to give yourself more time to recover. That's a big
Oh,
one. So what you used to be able to do, we kind of touched on it with the stretching and stuff, but you also need that recovery time. So rest days are really important. They're more important than ever. When our estrogen levels dips, our muscles don't fire as well and they don't heal as well. And that's the important thing. So if you look back at someone who is breastfeeding, so what happens is they talk about they feel all flubby when they're breastfeeding, and then they stop breastfeeding and everything tightens up. That's actually not what's happening. What is happening is their estrogen levels kick back in, because when you're breastfeeding, your estrogen levels have to be really low. or you can't make milk, their estrogen levels kick back in and their muscles heal and they fire better. So all that stretching that occurred when you were pregnant is now the muscles are learning to heal and come back together. Same thing happens in this sort of period that, you know, your estrogen levels are down, your muscles don't heal as well. So you have to be kind to them and, you know, you want them to work with you. So it's the same when we talked about deodorant. Things have changed and it's really hard. We hate change. Everyone hates change, whether you're a man or a woman, everyone hates change. So to have to change the way you exercise, to have to change your personal hygiene is really hard. But this is the time you are going to have to say, it's out of my hands. I have to change it.
Yeah, excellent. And when you're talking about recovery, does that typically look like having more rest days throughout your week, or what
Well,
might that?
they recommend that you do strength training 2 to 3 times a week and still do cardiovascular work, not so much the hip sort of stuff. It's really depends on the person. I hate being this rigid, as in you have to have a rest day every second day. I think it really depends on what you've done your whole life. You know, so if you've been an elite athlete your whole life, you might just need to do something like a stretching day instead of a rest day, or
Yeah.
a mobility day instead of a rest day. So there are lots of things that you can implement if you're that person who has to always be active. You don't always have to do the same thing. And we know that we need to train differently as we age. We know that balance becomes a huge issue. Like our balance starts to alter from 27, but we don't realise. So
Yeah.
we need to start looking at balance even at this age, because prevention is always better than cure. And if you think about women, why they end up in nursing homes, from a broken hip generally, which is a loss of balance and osteoporosis, or incontinence, and they can't look after their incontinence. This is the time in a woman's life that we can work on balance, work on incontinence, work on bone strength. So this is the time that we should be, like, people see menopause and perimenopause as a terrible thing. It's actually a window of opportunity, gives us a window of opportunity to know that we don't want to end up in a nursing home stuck in a chair because we can't walk because we've got fragile bones, we're incontinent, and we're losing our memory. So this is the time to work on yourself. And lots of people say, oh, but I'm too busy and it's selfish. It's not selfish. Everyone else does it. So you think I've got 2 teenage girls. My goodness, they are all about themselves. So, you know, why can't we get back to that? You don't have to be all about yourself, but you have to think, I want to live longevity. I want to be around to see my kids grow old. Or if you don't have kids, I want to be around to do whatever you want to do. I want to travel. I want to be as active as I can. And I want to be playing sport right to the end. That's what we need to look at, not just to have a long life, to have a long, enjoyable life.
Absolutely. I love that. It's such a great reframe, that window of opportunity, rather than it being, and working with our body, because our bodies are amazing, and this is what our body's designed to do. So,
Yeah. There's
yeah,
one
it's really good.
caveat that I would put on that. Women can really suffer during this period, and we have to acknowledge that as well. It's a really hard period for lots of women, and so it is a window of opportunity if we can support them to get into that window. But it is really hard. And the other thing I would say about perimenopause, it's expensive. It is really expensive if you want to go onto treatment. Even with the government rebates, it's still, if you're struggling, and it's really expensive. So we need to be aware that a lot of women are struggling, and a lot of the education out there is aimed at people who are already educated. And so we need to, and that's only a small percentage of the population with health literacy. If you look at our literacy in Tasmania, it's 12, and that's not health literacy, that's just literacy. Health literacy is a lot less. And so, and that's a huge amount of our population. And so we need to make sure that we're bringing all women along with this, because a lot of women are suffering.
That's a really important point. Was there anything else in your notes we needed to dash over? Are you happy with that?
I don't think so. There's so much. We could talk for hours, and there's so many different topics, but we want to talk about exercise. But I think just be kind to yourself and don't give up. If you can, I know it's really hard, and not being able to perform the way you used to is really, really challenging. But you are smart enough and you're old enough and you've had lots of time to do workarounds. Use those workarounds as much as possible, because that's where we come into our own. We have that experience, and experience is something that you can't replace.
Thank you so much for sharing all of this today. It's really, really valuable, and I hope everyone can take on board what they can implement themselves or within their sporting groups. If you want more information, then please go check out the WHEN Reps website, when.org.au. Peter's done an incredible job of gathering resources for changes that women experience across their whole life. So it's an excellent starting point if you would love to learn more as well.
Thank you so much for having me. We really appreciate you getting this sort of information out.
Yeah. Oh, you've been amazing. Thanks for all the work that you're doing. If this episode resonated with you, if you believe in visibility, representation, and strong pathways for women in sport, we invite you to join us. Women's Sport and Recreation Tasmania is a growing community of state sporting bodies, clubs, women, and allies working together to make sport more inclusive, connected, and supportive across our state. By becoming a WSRT member, you're helping amplify women's voices, stories, and leadership, both on the field and behind the scenes. Head to wsrt.org.au/membership to learn more about becoming a member. Because when we can see women in sport, we can be them.